January 2015, went into an urgent care thinking I might have pneumonia or a bad cold or something. I'd been feeling under the weather for about a month or so. Then they took a CT and said, you might have lymphoma. We're going to send you up to St. Francis, have them take a look at you and decide what to do. So got up to St. Francis, went ahead and took a biopsy of it and said, yeah, it's non-Hodgkin's large B-cell lymphoma.
David is a wonderful person, young man. We offered him treatments which required multiple visits to the hospital as well as to my office. And he has been through quite a bit of multiple treatment regimens. Because of David's job as well as the insurance, it was very important for him to be treated locally. And having my colleagues at Rush Memorial, we were able to arrange it without any difficulty.
So at Rush Memorial, we partner with Franciscan Health to provide cancer care for patients closer to home. We can provide the same type of concept as what a large hospital can in a small rural setting.
We bring to them the cancer care that they require without giving them the burden of the distance, driving, and obviously dealing with the disease. Cancer itself is a big burden.
On chemo days, going all the way to Indianapolis wasn't as big a deal because you're already going to be there for like 6 to 8 hours, but the day after you receive Neulasta, and it's just a shot and it takes like 2 minutes to administer, if that. It's really quick, and it just is such a waste to drive all the way up to Indianapolis when there's someplace closer by that can go ahead and do the job just the same, if not better.
And he was able to get the same plan of care under Dr. Ion, as well as following up here with the scans and other things like bone marrow transplant, where we needed him to come here. So that association and relationship worked very well in order to continue his treatment as well as having good patient care.
Nowadays, cancer care is not only one physician involved, it's a multidisciplinary team approach. So the great thing about having Franciscan Health with us and the affiliation with Rush Memorial Hospital is that the patient can have the best of two worlds.
It was crucial once we got to the bone marrow transplant stage because Rush Memorial is a small local hospital, and it was great that I could have the continuation of care at the Franciscan network. So to stick with Dr. Icklock until we did the transplant, and then even after the transplant, any chemotherapy I need, I can come back here.
It was so important for him it made him still feel like an individual and that he could be independent and be able to enjoy life and not just constantly be driving to a hospital.
I feel that this is a good opportunity for our patients who belong to that area. The staff is well trained, they're very compassionate. We see patients and their families are extremely satisfied while going through those treatments, as well as their ability to work with me and my staff very closely is also very commendable.
They got the best staff, they got the best doctors, and they take care of you, they love you, and they're with you throughout all of it.